Okay. So in this last unit, what we're going to talk about are pretty severe effects of radiation exposure. We're going to talk about some short-term effects, the main one being lethality. And then we're also in the next class, which will be next Wednesday, talk about late effects. But when we look at this term, acute radiation lethality, if something occurs acutely, what does that mean?
Bad.
It's quick.
It's quick, okay? So when we think of acute conditions, they usually have a fast onset with severe symptoms. Well, if we put this together and say acute radiation lethality, we're looking at very quick, severe symptoms from a radiation exposure. And that is potentially lethal or can kill you. So if you were to search for terms related to this, you might look for radiation poisoning, radiation sickness, things of that nature. But this is a type of early effect from radiation exposure. And by early effects, we mean the symptoms are manifested within hours, within days, or within a few weeks. When we talk about the late effects of radiation exposure, then we're looking at many weeks to months to years later. But the early effects are acute. They happen quickly, hours, days, or weeks. When we think about these early effects, they are typically somatic and they are typically deterministic. So when I say they are typically somatic, what type of effect is that? What does that mean?
Say that again.
What are somatic effects?
That means they kind of have the same effect.
They're of the body. They're of the person exposed. Remember, we can have either somatic effects or we can have genetic effects. And somatic effects are seen in the individual exposed. So if I'm exposed to radiation and my skin turns red, that's a somatic effect. So these early effects from an acute radiation exposure are typically somatic. They're seen in the individual that's exposed, and they are also typically deterministic. So give me another name for deterministic effects.
It's either non-stochastic.
They are non-stochastic. Yes, deterministic effects are also called non-stochastic effects. And more recently, we're just seeing them referred to as tissue effects. And these effects typically follow a nonlinear threshold dose response curve. Okay? So again, we're talking about radiation exposure, quick exposure, all the exposure given at once, and it can cause radiation sickness or radiation poisoning. So some of the symptoms of radiation sickness or radiation poisoning are seen here. Individuals may experience nausea, epilation. What is epilation? Hair loss. Exactly, hair loss. Anorexia. What's anorexia?
Weight loss.
It's a loss of
I mean,
appetite. It doesn't result in weight loss, but anorexia simply means a loss of appetite. Malaise. What is malaise?
Fatigue.
Fatigue, tired. You're very tired. Sore throat, petechia. What is petechia? Do anybody know? Anybody ever heard of this term? Petechia are small pinpoint hemorrhages of the capillaries. They show up as tiny red spots on the skin surface. Also, sickness, other symptoms include diarrhea and weight loss. So all of these are sort of generalized symptoms of radiation sickness. Now, in your Carroll text on page 777, there is a table, table 42-1, that looks at the early effects of radiation associated with specific doses. And we'll be looking at it a little bit as we go forth. But these are some of the things that we've already mentioned. At doses of 250 milligray, or that's 0.25 gray, you get a decrease in blood cell count. At doses of 500 milligray or 0.5 gray, you will kill 50% of the lymphocytes in your body, which are very important in our immunity. At 1 gray, that's the threshold typically considered for human death. So those are some of the things that we've already mentioned. And those are from total body irradiation, such as happened in radiation accidents. But again, we'll come back to this table as we go through the rest of this lecture. So if we're going to talk about acute radiation lethality, we can talk about it in terms of two different things. The first is the median lethal dose, and the second is mean survival time. So the median lethal dose is related to how much radiation it takes to kill a certain percentage of a population. Mean survival time, the mean is the average. So that's the average time that a group of organisms would survive following a radiation. And again, when we talk about acute radiation lethality, we are talking about an acute exposure, so the radiation given in a short period of time, to the total body, okay? So again, these are the types of irradiation that would never occur in medical imaging. We irradiate specific body parts, not the whole body. But these are the types of exposures that would occur from a nuclear power plant accident, from an act of war, something of that nature. All right, so we're going to start first with LD 5030 and LD 5060. LD stands for lethal dose. The 50 refers to the percent of the population, and the 30 refers to the number of days. So the LD 5030 is the dose of radiation that would kill 50% of the population within a 30-day time period. LD 5060 is the radiation dose that's going to kill 50% of the exposed population within a 60-day time period. If we look at the concept of median lethal dose, or the dose to kill someone, notice that it follows a nonlinear or sigmoidal. You see how it's kind of S-shaped. So we see it's kind of S-shaped. So it's a nonlinear threshold dose response. The threshold for lethality is at 100 rads or 1 gray. So below that, a dose of radiation, even to your total body, is not likely to kill you. But after that, as the dose increases, we see the dose going here from 1 gray to 2 to 3 to 4 to 5 to 6 gray. And look at what happens to the lethality percentage, going up, up, and up. The thing you note here is that after 6 gray or 600 rads, almost everybody's dying. So what is the LD5030? Well, the LD5030 varies from organism to organism. So let's look at this. And this is from an older textbook, but it's a pretty comprehensive list. Note that the this is for LD5060, so the lethal dose to kill 50% of the population within 60 days, and it's in rads. So if you want to convert it to gray, which is the unit you should be most aware of, you simply move the decimal 2 points to the left. So if we look at pigs, pigs have an LD5060 of 250 rads or 2.5 gray. Dogs, 275 rads or 2.75 gray. Humans, 350 rads. And from the Chernobyl accident that occurred in the 80s, they've updated the data. So for humans, they say that the LD5030 and LD5060 are very similar, is between 350 and 400 rads. So 3.5 to 4 gray. So if we had an entire population exposed to that level of radiation, half of them would be dead within 30 to 60 days. And so as we go down the list, monkeys have a higher LD5060 than humans. Goldfish, okay, a 7 gray.
Hey, cockroaches are indestructible.
You cannot kill a cockroach. You know that. Nobody can ever kill cockroaches. There have been experiments where they froze them, they boiled them. Nothing kills cockroaches unless you squish them or grind them up. Yeah, look at that. So what this tells you as you look down the list is that the higher the LD5060 or the LD5030, the more radio resistant that population is. So on this list, pigs are the most radiosensitive. They would be the most easily killed organisms by an acute exposure to radiation. Humans, well, we're also toward the low end. We're pretty sensitive. But when you get to this level, cockroaches, you can't kill cockroaches. I swear, 100 gray it's going to take. Everybody know what a newt is? A newt's like a lizard that lives like a lizard, like a salamander kind of thing.
The Geico one?
I thought the gecko was a gecko.
Oh.
Which is a lizard. Newts are of course similar, they're just slimy. Armadillos and turtles have shells, so that makes sense. Their shells will protect them. But it's just interesting. But the higher the value, the higher the LD5060 or the LD5030, the more radio resistant the population is, and the harder it is to kill them with radiation. For humans, LD5030 and LD5060 is now stated as somewhere between 350 and 400 rads or 3.5 to 4 gray. If you exposed a human population to between 6 and 7 gray, so that would be 600 to 700 rads, almost everybody in the population would die. So if you get beyond that 600 rad or 6 gray mark, pretty much it would kill 100%. It wouldn't kill 50%, it'd kill 100%. Your textbook made a note, and I'm going to have to investigate this because I wasn't aware of this. They said that the largest dose ever survived by a human is 8.5 gray. So that's 850 rads. So that's quite high. But do we all have the same radio sensitivity as humans? Do we all have the same radio sensitivity?
No,
Okay, why not?
some people are sick.
Okay, some people might have
Anatomy.
underlying medical conditions, but radio sensitivity, remember, also varies with age, body weight, metabolic rate, stress levels. Can also vary, the effects of radiation can also vary with what they call diurnal variations, which is the time of day, were you active, are you inactive? So there's all sorts of variables. That's why it's an estimation, because everybody is a little bit different. So we can say that LD 5060, somewhere between 3.5 and 4 gray. So if we exposed our entire class to 3.5 to 4 gray, we would expect half of us to die. But that doesn't mean we will. You know, if a single individual can survive at 8.5 gray of radiation, you know, maybe we could too. So there is some variation because of just that we are different in terms of our metabolism, our weight, all those things. But anyway, higher the LD 5060 value for a group, the more radio resistant. Okay, now we're going to look at the second way we can talk about radiation lethality, and that is looking at mean survival time or average survival time. So this is the average time that a group of animals would survive following irradiation, whether they be humans, dogs, pigs, whatever. And this mean survival time is dose dependent. And in all honesty, that's common sense. We know the higher the amount of radiation received or the higher the dose, the more severe the effects. So it makes sense that the higher the dose, the shorter the survival time. If we look at this graph, here we have radiation dose in rads. So this is starting at 100 rads. I'm starting at 0. Starting at 100 rad, this would be 1,000 rad. This would be 10,000, okay? Move the decimal for gray. And here we have survival time. So as dose is increasing, look at what's happening to survival time. It is decreasing. So in general, the higher the dose, the shorter the survival time. And again, that's common sense. When it's graphed out, there are actually 3 distinct regions that will relate to 3 acute radiation syndromes, but they are labeled here. In this range, this first light blue range labeled region 1, what we see is dose is going up, survival time is coming down. So this is a dose-dependent area. And in the dose range from about 2 gray to maybe 600 or 700 gray, that is dose dependent. and the survival of the organism, and this is data on humans, ranges between 4 and 60 days. Okay, so some people may die as early as 4 days after exposure. Some may die or may live as long as 60 days. But the higher the dose, the shorter their survival time. In this second region that we would associate with the gastrointestinal acute radiation syndrome, the curve flattens out. You see, it's at a plateau. This dose range is somewhere between 7 gray and maybe 50 gray. In that dose range, survival time is roughly 3 to 5 days. It doesn't matter if you were exposed to 800 rads or 8 gray, which is on the low dose end, or if you were exposed to 30 gray, which is toward the high dose end, nobody's really living longer than 3 to 5 days. Then when you get to the third portion of the graph, the section associated with the central nervous system acute radiation syndrome, we once more see dose dependency. Dose is going up, survival time is dropping drastically. So this would be an ultra high dose level, greater than 100 gray or greater than 10,000 rads. And in that time period, or in that dose level, the time period is very short. Survival as little as 1 hour to the longest time frame of about 3 days. If we look at the graph as a whole, again, what we see is, as a whole, dose is going up, survival time is coming down. Even though there's this plateau region in the middle, again, the overall trend is downward. So as radiation dose increases, survival time decreases.
How much did you say region 3 was again?
Region 3 is at dose levels of above 100 gray or 10,000 rads. So very high dose levels. All right. So when we think about mean survival time, as dose is increasing, the number of organisms dying is increasing. We know higher the dose level, the greater the amount of biological effects. So as dose is going up and up and up, more and more organisms will be dying. The second part of that is, as dose increases, the survival time decreases. So they're going to die more quickly. If you were exposed to 70 gray, you are going to survive maybe a day or two. If you were exposed to 7 gray, you might survive 60 days. But in general, if dose is increasing, survival time is decreasing. Okay, so in general, when we talk about acute radiation lethality, we know this is an early effect of high-level total body irradiation. This type of exposure would not be seen in medical imaging. This type of radiation exposure would come from an act of war, a nuclear power plant accident, something of that nature. When people are exposed to whole body high level radiation, it can be lethal. And we can describe, or we can talk about this lethality in one of two ways. We can talk about it in terms of the dose required. So that's the median lethal dose. It's the lethal dose to 50% of the population within 30 days or to 50% of the population within 60 days. Those are the two most common expressions. An experimenter could look at the lethal dose to 75% of the population in 100 days if they wanted to. But these are the two most common expressions of median lethal dose. And we know in humans, somewhere between 3.5 and 4 gray. Other organisms, some are more radiosensitive and have a lower LD5030. Some are much more radio resistant and have a much higher LD5030 or LD5060. So when we're talking about it in terms of dose, we talk about median lethal dose. When we're talking about it in terms of mean survival time, we need to look at the total dose received, and then we can estimate survival time. Shamarva, you had a question?
I think you just answered it.
Okay. All right. So anyway, these are just two different ways that we can talk about radiation lethality. Now I am going to exit out of this presentation, and I'm going to, I'm not sure what this one is doing, but I guess we'll figure it out. All right, so what we're going to talk about in this unit are the acute radiation syndromes. And the acute radiation syndromes occur from an acute total body exposure to a high level of radiation. Again, something that would not occur in medical imaging, but from a nuclear power plant accident, a bomb explosion, an act of war, something of that nature. So these are things that, unless there's some kind of major incident, you're not going to see patients who have acute radiation syndromes. So we're going to start with just a little bit of a review about what we've just already said. We remember LD5030, the lethal dose to 50% of the population within a 30-day time period. And for humans, what's the dose range?
3.5 to 4 gray.
3.5 to 4 gray. For cockroaches, would you consider them to be more sensitive or less sensitive to radiation than humans?
Less sensitive.
Less.
Much less sensitive. Okay. Sadly, dogs are more sensitive, since I like dogs, you know. But anyway, for humans, an LD5030 of 3.5 to 4 gray. So if a large population of humans was exposed to that dose range, you would expect half of that population to be dead within 30 days. We also mentioned briefly mean survival time. So the length of time between an exposure and an organism dies, or the average length of time. Now, if in that same group of humans that were exposed, if part of them were exposed to a lower dose of radiation and the other part exposed to a much higher dose, the population exposed to the higher dose would die more quickly, because a higher dose is associated with greater biological damage. So as radiation dose increases, survival time decreases. So if we look at the acute radiation syndromes, These are the sequence of events that occur after a very high level exposure of the total body that ultimately will lead to death within days or weeks. Okay, so a short time. These are early effects. They're called syndromes because a syndrome indicates a collection of signs and symptoms from a specific cause. So in each of these syndromes that we look at, there are very specific symptoms that result from radiation exposure at that particular level. So again, when we think of the radiation syndromes, we think of an acute exposure, so all at once or within a very short time period, an external source of radiation, and total body exposure. So those are three things we associate with the radiation syndromes. There are three specific syndromes that relate to different dose levels. There is the hematologic or hematopoietic syndrome, the gastrointestinal syndrome, and the central nervous system syndrome. So if we look at the approximate dose levels, and we'll talk later at the very end about the fact that there's no one set exact threshold for every human being, okay? So these numbers are sort of the ballparks, and we'll stick with them. So at a dose level of greater than 2 gray, which is 200 rads, that would put you into the hematopoietic syndrome. And that would affect all the blood cells. So your symptoms would be associated with a decrease in blood cells. A decrease in white blood cells makes you susceptible to infections. A decrease in the platelets makes you susceptible to hemorrhage. A decrease in the red blood cells means that you would be anemic, okay? So when you think about the hematopoietic syndrome, know that it is associated with a loss of the blood cells. If we look at the second syndrome, approximately 6 gray threshold, that's the GI syndrome. So it's going to affect the gastrointestinal system. So you might have bleeding, you might have a failure to absorb nutrients, you might have electrolyte imbalances, you might be dehydrated, you might have profuse diarrhea. All of those symptoms associate with a GI system malfunction. Did you have a question, Shamarva?
I do, because I was wondering about the things that are in between. So like from 700 rad up to 2000, is it just going to be GI?
It's just going to be GI.
Okay.
It's just the symptoms worsen as the dose goes up, but it would still be GI. If the patient lived long enough, they would have hematopoietic symptoms as well. So technically, if you had a dose of 6 gray, you would have both the hematopoietic syndrome and the GI syndrome, but the GI syndrome is going to kill you before the hematopoietic symptoms are ever manifested. So, but yes, between like 2 gray and 6 gray, that's hematopoietic. Between 6 gray and 20, that's GI. Above 20, then you get to the central nervous system. But again, if you were to live long enough, you would have symptoms of all of them, but nobody typically lives long enough.
Is that why people start losing their limbs? Because of the hematopoietic part?
No, I wouldn't think they would. That's not typical of hematopoietic. That might be typical of central nervous system because you get vascular collapse. So you don't get circulation.
Okay.
Okay. But if we look at the very, very high end dose levels of 20 to 30 gray, that puts you into the central nervous system syndrome. And at doses of that level, death occurs very quickly. But again, these are the three separate syndromes. And we're going to look at each individually in just a second. But again, each is named for the organ system that is predominantly affected. All right, so each of the acute radiation syndromes has 4 distinct stages. Each syndrome has a prodromal stage or prodromal syndrome, a latent period, a manifest illness period, and then the recovery or death period. So the hematopoietic, GI, and central nervous system acute radiation syndromes all have these 4 stages. So if we look at each of the stages, the prodromal stage is the first. And the prodromal stage is also called the NVD stage because it stands for nausea, vomiting, and diarrhea. These are classic symptoms that occur in a very short time period after a high level exposure. So if it's at the dose level of the hematopoietic syndrome, you might not see these symptoms for a few hours. If it is for the central nervous system syndrome, if you're at that dose level, you would see them virtually immediately. But it is dose dependent, and the higher the dose, the worse the symptoms will be, and the sooner the symptoms will be seen. But that's the period, that prodromal syndrome or prodromal stage occurs shortly after the exposure. Okay, so you would be exposed to a high level of radiation within a few hours or within a few minutes to a few hours, you would have symptoms of nausea, vomiting, and diarrhea. The second stage of each of the acute radiation syndromes is the latent period. Well, the latent, if something's latent, it's not seen. So the latent period is the period of time which you don't have any symptoms. You're symptom-free. You're basically normal. The length of this period is dose dependent. The higher the dose, the shorter the time frame. So for example, with the hematopoietic syndrome, the latent period will be the longest. With the GI, it will be shorter. With the central nervous system syndrome, it's almost non-existent, but it's a very short time. So the higher the dose level, the shorter the latent period. Then we have the manifest illness stage. Well, if something is manifest, then it's visible. We can see it. So this is when the patient would be actively ill. They would have all of the different symptoms of their particular syndrome. So if they have hematologic or the hematopoietic syndrome, they're going to have symptoms associated with decreased blood cells. If they are the dose level of the gastrointestinal syndrome, then they're going to have symptoms related to GI distress. And If they are at the dose level of the central nervous system syndrome, then that is such a high dose level that basically we're seeing vascular collapse and other issues associated with the central nervous system. And we'll look at those particular symptoms just a little bit later. But the manifest illness period, that is when you're showing the symptoms based on your exposure level, whichever dose level or whichever syndrome you would be put in based on dose level, that would be the symptoms that you have. And then, of course, the last stage is recovery or death. At this point in time, even with advanced medical treatment, most people can only survive the hematologic or hematopoietic syndrome. Persons exposed to levels that push them to the GI and the central nervous system syndrome typically die. Now, like I said, I'm going to have to do some investigation because the textbook indicated that there was evidence of somebody who had survived from an 8.5 gray exposure. Well, that's in the middle of the GI syndrome. Well, it's toward the low end of the GI syndrome dose range. But typically nobody survives that dose range. Even with treatment, like I said, the hematologic or hematopoietic syndrome is the only syndrome which is typically survivable. So here are the associated dose ranges that we are going to use. And again, they are variable. Hematologic, 2 to 10 gray, GI, 10 to 100 gray, CNS, 100 gray and above. And this is for all organisms. Now we're going to narrow this down a little specifically to humans, but these are the dose ranges across all organisms. And again, we note each of these dose ranges associate with a specific section on that mean survival time curve, noting that as dose increases, survival time decreases. All right, so we're going to look at each of the syndromes a little more closely, and we're going to narrow the dose range for humans. So, for the hematologic syndrome, the dose range for humans is 2 to 7 gray. We know that the organ system most effective are the blood forming organs or the bone marrow, which is where the blood cells are formed. The latent period for the hematologic syndrome is typically 2 to 3 weeks. So say a person is exposed to 3 gray, acute exposure, total body exposure, within maybe the next 8 hours, they're going to have a time period of the prodromal syndrome, nausea, vomiting, diarrhea. And then for 2 to 3 weeks, they're going to be fine. The reason that they're fine for 2 to 3 weeks is, remember, the functional cells are resistant. So the functioning blood cells are going to be doing their thing. You won't have a problem until their lifespan is up. And once their lifespan is up, the stem cells that were killed by this level of irradiation are not going to be available to replace them. So you are going to have decreased blood cells across all blood types, or all blood cell types. Okay, so the latent period is 2 to 3 weeks. Then you get to the manifest illness. And we'll talk about the symptoms of the manifest illness in just a second. But ultimately, mean survival time for this syndrome is 1 to 6 weeks, or another ballpark is 4 to 60 days. But again, this syndrome is survivable. So the general symptoms associated with the hematologic acute radiation syndrome: nausea, vomiting, diarrhea. They are associated with every syndrome. We also have fever, because remember, the white blood cells are killed and that makes you more susceptible to infection. So you're at higher risk, so you're likely to develop fever. And leukopenia. What is leukopenia?
Without white blood cells?
Just means a decreased white blood cell count. The specific symptoms associated with the hematologic acute radiation syndrome are anemia due to too few red blood cells, hemorrhage due to decreased platelets, and again, susceptibility to infections because you have too few white blood cells. Remember the lymphocytes, that small lymphocyte, that's one of your first lines of defense against invasion. Remember the antigen-antibody reaction. But the good news is treatment for this syndrome is available. You can isolate the person to keep them in a relatively germ-free environment to prevent infection. You can make sure they have enough circulating fluids with IVs. You can do blood transfusions. You can do bone marrow transplants. All of you are too young to remember, but when Chernobyl happened, one of the things I remember in the news was that physicians from all over the world went to Russia to perform bone marrow transplants to help some of those patients survive. And that was big news because it was a cooperation among a lot of different countries in the world. But the hematologic syndrome is treatable because we have the technology for bone marrow transplants and we can fight off infections with isolation and antibiotics. But the reason this syndrome occurs is that at that dose level of greater than 200 rads or 2 gray, the stem cells are damaged so that when the lifetime of the functional cells is up, there's no replacement. There's no replacement cells, so that means that, or few replacement cells. So that means that the anemia, the susceptibility to infection, the susceptibility to hemorrhage occurs, all because of decreased blood cell counts. So again, the bad news is this can be fatal. The good news is that there are at least treatment options. Treatment is available for this syndrome. And some patients who receive treatment can make a full recovery in as little as 6 months. That's positive. All right, so that gets us through the hematologic syndrome. And so now we look at the gastrointestinal syndrome. Now the gastrointestinal syndrome is the second dose range, and for humans, 7 to 50 gray. And this syndrome corresponds to this plateau level on the graph. The organ system that is primarily affected is the small intestines. So what's the function of the small intestines?
Absorption.
Absorption of nutrients. That's the main function. So if the small intestines are irradiated at a very high level, it kills off the cells on the intestinal villi, which are radiosensitive. Does anybody remember the cell type? Remember the cell type on the intestinal villi? They're referred to as the intestinal crypt cells or the crypts of Lieberkühn. So they are very radiosensitive because they are rapidly replenishing cell population. And because they're radiosensitive, that means that dose level can pretty much wipe them out. The latent period is 3 to 5 days. So with this syndrome, say if you hit that 7 gray threshold, within a matter of hours, you're going to have the prodromal syndrome, the nausea, vomiting, diarrhea, and then you'll feel okay for 3 to 5 days. Remember, with the hematopoietic syndrome, you had some weeks that you felt okay. But with the gastrointestinal syndrome, higher dose level, shorter latent period. The symptoms would then follow the latent period, that manifest illness period. All those symptoms would be related to a failure of the small bowel. Survival time is relatively short, 3 days to 2 weeks. And it really doesn't matter where your dose falls within that range of 7 to 50 gray. Everybody dies in about that 3 day to 2 week time period. So it's a dose independent region, meaning it's flat. So if your dose is down here at the 700 rad or 7 gray, or if it's in the middle at 20 gray or 2000 rads, or if it's at the high end at 50 gray or 5000 rads. Everybody's dying at the same time. It's dose independent. So for symptoms, the symptoms, of course, the NVD, nausea, vomiting, diarrhea, those are classic symptoms. Malaise or the tiredness, anorexia, loss of appetite, and associated weight loss with the anorexia. All of those are general symptoms of the GI syndrome. Specific symptoms, electrolyte imbalance, because again, the function of the small bowel is absorption. Dehydration, we say GI malfunction, that would mean massive fluid loss, bloody diarrhea, those types of symptoms. So not a pretty sight. Treatment. Well, treatment is primarily supportive. At this point in time, we can't transplant small bowels. The organ failure is essentially the same as with the hematopoietic syndrome, except related specifically to the small bowel. Those intestinal crypt cells, the crypt of Lieberkühn cells, are very radiosensitive, especially the stem cells. So the stem cells are going to be damaged as the functional cells die off. There are going to be insufficient cells to replace them. Therefore, you're going to have a malfunction, basically, of the small bowel. Now, if the patient lived long enough, they would also have signs and symptoms of the hematopoietic syndrome. So some of those may be thrown in as well. But typically, with a dose level that puts you into the GI syndrome, the patient does not live long enough to develop the symptoms of the hematopoietic syndrome. But with the GI syndrome, basically, death will occur within about a week or so, and there's not a whole lot that can be done in terms of treatment except supportive treatment. Now, the last of the acute radiation syndromes that we look at is the central nervous system syndrome. So this is at the very high end of the dose range on the graph all the way over here. So for humans, anything above 50 gray. The organ system primarily affected is the brain and the supporting structures of the brain. So the brain, the spinal cord. Look at the latent period. Only 1/4 of an hour up to 3 hours. So at this dose range, at an exposure of this level, the person would immediately go into the prodromal syndrome. I mean, they are immediately going to be sick, nausea, vomiting, diarrhea. And within a very short time period, they're going to be into the manifest illness stage. And survival time for this syndrome is very short, less than 3 days typically. So this is a massive, massive exposure. General symptoms, of course, there's the immediate nausea, vomiting, and diarrhea that are not listed here. They're just that immediate prodromal syndrome. The patient's going to be tired. They may have seizures. They may have ataxia. What is ataxia?
Nosebleed.
I'm sorry?
Is it a nosebleed? Oh, wait, that's.
No, that's epistaxis.
Is that like impaired like balance or something? Like
it's a lack of coordination. It's uncoordinated movements. So they might appear spastic. So spastic muscle movements. So like they couldn't control their arms and legs. They couldn't walk as normal. So those would be general symptoms. The specific symptoms really relate to inflammation of the brain coverings and the vasculature of the brain. And as the vessels break down, you have fluid seeping into the brain, so you have swelling of the brain, and that ultimately results in putting the patient into a coma, and then the patient will die. The nerves themselves, remember the nervous system is very radio resistant. So the neurons are really still functional, but it's all the supporting tissues, the vascular tissues that break down. So you have vascular collapse, leakage of fluids into the brain, so you have swelling of the brain, and you also have inflammation of the vascular structures and the coverings of the brain. So it's like an acute inflammation. Treatment in these cases is only supportive. To my knowledge, there have been no known cases of an exposure at this level with any survival. And we talk about what does death result from? Basically, vascular collapse, edema in the brain that leads to intracranial pressure increases. And those increases in intracranial pressure basically send the patient into a coma from which they cannot recover. So I've included this chart just to give you sort of an idea. This relates different dose levels. If we look at the first dose level of 0.5 to 1 gray, that technically is below our threshold. Somebody in that threshold, and even in the second dose level of 1 to 2 gray, this is considered below the acute radiation syndrome threshold. Remember, it starts at 2 gray. So even with an acute whole body exposure below 2 gray, most everybody's going to survive. When you get to 2 gray, that's the threshold for the hematopoietic syndrome. Here it says bone marrow damage, but still, it's a good chance with treatment you can survive. As doses go higher, the likelihood of survival drastically decreases. So here, 3.5 to 5, 5.5 to 7.5, 7.5 to 10. You know, we are going through the GI syndrome into the central nervous system syndrome, where we get to cardiovascular collapse. So this again shows that as dose increases, effects will increase in severity and survival time will decrease. So some conclusions to kind of pull things together. The prodromal syndrome, that's that first stage of the acute radiation syndrome. It's going to vary in time of onset, severity, and duration. The higher the dose, the quicker the onset, the more severe. The symptoms at LD 50, or a lethal dose to 50% of the population, would include loss of appetite, nausea, vomiting, and fatigue. Symptoms at a supralethal dose, so a dose that's able to kill you, immediate diarrhea, fever, and possibly a loss of blood pressure, so hypotension. Remember the LD 50 for humans? Somewhere in that 3 to 4 gray range with no treatment. We said LD 50 30, 3.5 to 4, LD 50 60, about that same time frame. At doses of 7 gray, or the LD 50 for doses of 7 gray, well, let me see. With treatment, antibiotics, and fluids, you could potentially survive a dose of up to 7 gray. So that's putting you in that right at the border of that hematopoietic GI syndrome. So you can survive up to that level if you get treatment, hopefully. Remember the dose ranges we said are a little bit variable. Hematopoietic, Statkiewicz, which is your safety textbook, says 1 to 10 gray. Carroll says 1 to 6. Hall, which is one of my reference texts for radiation biology, the ones the radiologists use, says 2.5 to 5. So again, there's variability. We're going to go with the 2 gray as our threshold. For the GI, Statkiewicz and Carroll say the threshold is 60, but they give a much broader dose range. Hall says it's at 10. We're going to go with what we said, which is 7 gray as our threshold. And then for the CNS, again, Statkowitz and Carroll say 50 gray. Hall says 100 gray. We're going to go with 50 gray for the threshold. But again, there's no exact numbers. You're just looking at sort of a ballpark. These last slides that I have included are just a synopsis of each of the syndromes that I took from, I think, the Hall reference. But it's telling you the prodromal stage, anorexia, nausea, vomiting, the latent stage, what's happening, you know, the stem cells are dying, the normal cells, the functional cells are still working. So you've got a latent period of 1 week to several weeks. And then it's just a review of symptoms and recovery. And you know you can recover from this syndrome. Here's the GI syndrome, same thing, just what we've covered. And then we have the cardiovascular central nervous system syndrome. And again, the same thing. You would not ever expect recovery, death within just a matter of days, 2 to 3 days at most. So the acute radiation syndrome is a little depressing, I know. Depressing because, you know, there's not a very good outcome for 2 of the 3 syndromes. However, the good news is in a medical situation, you should never, ever see this type of result from any sort of exposure that we would provide.
Well, that's a good thing.
That's a good thing. I'm going to share my screen again and show you a chart. I hope it's here. I thought I pulled it up, but I'm not seeing it. So I will share this. I think it's next. I posted this handout, which is a synopsis for the dose levels that we will be using for the test. You just have to convert to gray or to sievert. And again, it's just move the decimal point. 200 R's, 2 gray, 700, 7 gray, 5,000's 50. But this is a synopsis, just a really good synopsis of all the different information that we have covered. So that's posted on, you can print that, it's in the module on Canvas. Now, the last thing I want to do before we look at our, or see our presentations, I want to give you some examples of syndromes, what occurred, and I want you to tell me which syndrome you think it is. These happened a long time ago, but they did happen. So here's the first case study. It says in 1946, a 32-year-old worker was admitted to the hospital within 1 hour of a radiation accident. His total body dose was estimated to be 20 gray. The patient vomited several times within the first few hours after exposure. On admission, his temperature and pulse rate were slightly elevated. However, the remainder of his physical examinations were within normal limits. His general condition remained relatively good until the 6th day, when signs of severe GI distress developed. Within 24 hours, 10 liters of fluid had been removed from his GI tract. On the 7th day, bloody diarrhea developed. Patient developed signs of circulatory collapse and died on the 9th day post-irradiation. At the time of death, jaundice and severe GI hemorrhage were observed. So what syndrome?
GI.
He had the gastrointestinal syndrome. That 20 gray puts him in that dose range, and also all of the symptoms point to that. And death basically was on what, like day 9? Yeah, on day 9. So again,
that was another thing I thought about, because the first hint was that he died he took too long to die to be CNS.
That's right. It took too long to die to be central nervous system.
Yeah, I didn't mean to say it like that, but you know.
That's the truth. There's no way, it doesn't matter. All right. Here's a second one. In 1964, a 38-year-old man working in a uranium processing plant was involved in a nuclear accident. He received a total body dose estimated to be 110 gray. He recalls seeing a flash and was hurled backward. However, he did not lose consciousness and was able to run from the scene to another building 200 yards away. Almost at once, he complained of abdominal cramps and headache, vomited, and began to experience bloody diarrhea. The next day, the patient was comfortable but restless. On the second day, his condition deteriorated. He was fatigued, apprehensive, short of breath, had impaired vision, and blood pressure could only be maintained with great difficulty. 6 hours before his death, he became disoriented and his blood pressure could not be maintained. He died 49 hours after the accident.
Sounds like
CNS.
GI, but then at first it sounded like GI though.
Well, remember, nausea, vomiting, and diarrhea are a part of the prodromal syndrome of each acute radiation syndrome. The key should have been immediately when it said 110 gray. That would have been your key. All right, the last one. In 1960, a truck carrying, among other cargo, a cobalt-60 source was hijacked near the Mexican border. Cobalt-60 is radioactive, it's a gamma emitter. A few days later, a Mexican farmer found the source lying in the desert and decided to bring it home as an ornament. Upon arrival, he placed the source in the center of the kitchen table. It was not until some 40 to 50 days later, when 11 members of his family had died, that he reported the situation to the authorities. Cause of death was determined to be massive infection resulting from bone marrow failure. So, hematopoietic syndrome. Don't pick up strange objects and put them on your kitchen table. That should be the moral of that story. When you kill 11 of your family members.
Sounds like he was a suspicious